Hi, I'm Elise and I'm the Knowledge and Support Officer here at Healthwatch Salford. From April 2020 to March 2021, we heard from 1,525 people about their experiences of health and social care in Salford via our various surveys and our feedback service. We have also provided advice and information to 1,820 people during that year via our feedback and signposting service and our website's advice and information pages. We engaged with and supported 162 people during the COVID-19 pandemic this year, with issues such as accessing the COVID-19 vaccines or for advice on where to receive support while shielding. The top 4 areas that people have contacted us about during April 2020 to March 2021 were GP services, dentistry, hospital care and COVID-19 vaccinations. In the past year, in collaboration with Salford CVS and Salford CCG, the Trusted Voices Champion volunteer roles were set up to assist in sharing official information, key messages and current public health advice and guidance through the volunteers' networks of colleagues, friends and family to help stop the spread of coronavirus within Salford. Trusted Voices volunteers were emailed once a week with the latest COVID-19 messages and information to share with their networks, with over 100 volunteers signed up to the role. In October 2020, we launched our new website. The new Healthwatch Salford website shares many resources to help people find the information they need, along with helpful tips and advice to get the best from their appointments. The website has a sleek new look that makes for a better experience and exploring. We've kept all of our features, but made the website more accessible to ensure a smoother experience for all. Our new website is easy to use and we encourage you to use it, and we welcome your feedback. You can also view past and upcoming events happening locally, learn more about Healthwatch Salford and find out about opportunities to volunteer or read our latest advice and information articles.
Hi, my name's Ali McLeod and I'm an engagement officer at Healthwatch Salford. I'm just going to tell you a bit about the projects that I've been working on this year. So at the start of the year I worked on a priorities project which helps Healthwatch Salford to set their priorities for the coming year and set the focus of their work. Out of that survey, you told us that you wanted us to focus on primary care, adult mental health and adult social care. And we listened to you, and out of those surveys and that response, we've now developed projects on dentistry, the Living Well project, which focuses on a mental health service, and a project on home care. Next, I was working on a project on equipment services. So I was working very closely with the CCG and equipment services to survey all of the 1,500 users who'd used the service in the last 6 months, to find out what they thought about the service and to look at any improvements that could be made. We had an excellent response to the survey. We had 335 surveys back, which was a 22% response rate, so we were really pleased with that. And the feedback was overwhelmingly positive about the service. People were really pleased with the service that they were receiving. However, there were some issues that people raised with us, and we developed those into recommendations and took that back to the CCG and equipment services, and all of the recommendations that we had advised were taken on board and accepted. Over the next couple of months, I'll be going back to equipment services to check on the impacts of those recommendations and to check that they were followed through. A project that I'm just about to start now is looking at people's experiences of social prescribing through the voluntary and community sector. So that's something that I'm going to be working on for the next couple of months. And then after that, I'm going to be very busy doing a project on home care, which will be involving sending out a survey to all 1,300 service users and evaluating what they think about the service that they receive and how it could be improved. And I'm working very closely on that project with Salford Royal NHS Foundation Trust. And that's what I'm working on this year. Thank you.
Hello, I'm Mark and I'm part of the engagement team for Healthwatch Salford. During the last year, the pandemic has thrown a serious challenge for us at Healthwatch in how we engage with people across the city. We have nevertheless done the very best that we can and delivered quite a few good projects. One of which was, during the pandemic, for 3 months, we launched a short survey asking people how the COVID-19 pandemic and especially the lockdown was affecting them. We shared these results with Salford City Council and Salford Clinical Commissioning Group just to help them in a real-time process better deliver those services for the population. We were also able to publish 2 reports from projects we hosted just before the pandemic started. These projects were looking into men's health in Salford and also women's health in Salford. In addition, we also launched our Healthwatch Salford Community Forum, which was an online forum bringing together members of the public and health and social care professionals to talk about matters that were really important to them. We ran a series of 6 of these events and we got some really good feedback from all participants. A lot of actions were generated from the forums where we would undertake actions to find out more information and report back to the participants from the previous meetings. We also launched a remote appointments report where the project looked into chatting to people who were having remote healthcare appointments either by video link or telephone, culminating in a report which was well received by commissioners and providers alike.
Hi everyone, I'm Scarlett. I'm the Volunteer and Involvement Officer at Healthwatch Salford. Over the past year, we've had 21 volunteers who have supported us by giving 140 hours to the organisation, so we're really grateful to them for their support, especially as we've been working primarily from home this year. So some of the things that volunteers have been getting involved in include our Readers Panel. Our Readers Panel is where organisations such as Salford CCG and the Northern Care Alliance share documents that are intended for the public to read with our volunteers in advance. So volunteers can look at the documents and see if they are easy for the public to read and understand, not too full of jargon, and that topics are handled sensitively in these documents. We then share this feedback with the organisations and they can implement the changes, meaning that the public have a better experience using these documents. Some of the other things that volunteers have helped us with in the past year include attending our online community forums and giving their feedback there, and also by helping us with data entry. We've done a lot of projects that have involved paper surveys, so our volunteers have been able to have these posted out to them at home and they've been able to input them from home. So that's been a really big help, and we want to say a huge thank you to our volunteers for all of their hard work over the past year. One of the exciting projects that we're working on in 2021 is the Speak Up Salford Fund. This is a small grants fund intended for local organisations and community groups in the city to apply for funding and put forward a project idea that will encourage people they work with and people they have trusted relationships with to come forward with their feedback on health and social care in the city. At Healthwatch Salford, we strive to be inclusive, and it's one of our values as an organisation. So we want to ensure that as many people as possible can come forward and have their say, regardless of their background or circumstance. So through the Speak Up Salford Fund, we're hoping that we'll hear from seldom heard groups who can come forward with any issues they're facing with accessing services, their experiences of treatment, and their perceptions of services. We're working with 2 groups at the moment. One is Sorelli, who work with refugees, and Europia, who work with Central and Eastern Europeans in Salford. We're really looking forward to hearing the feedback they collect from their projects, and we're hoping to hear from even more groups across the year.
Hi everyone, I'm Holly Mansour and I'm an engagement officer at Healthwatch Salford. I work on the Living Well project, which is a service supporting individuals with their mental health. I've been in the role since June and I thoroughly enjoy it, and I can already begin to see the positive impact doing this work has made. I conduct ethnographic research from individuals who've received support from Living Well. This is a more in-depth approach to understanding how the support from Living Well was for the people accessing it. It also allows me to understand what they would have liked done differently and what could have made the experience better. The research I conduct will look like a journey of their whole experience of living well and before they access the service. The individual will share what they feel comfortable with, but it usually focuses on areas which include what their mental health was like before being with Living Well, mental health services that they've used before and how this was for them, how they got referred to Living Well and their experience with the Living Well team. All information individuals give is always anonymous. This way we receive transparent feedback in order to inform Living Well of the feedback gathered. The feedback is fed back to Living Well, who are conscious of what could be better, and this allows them to understand what they are doing good and what they can do to make the service even better for the future. Doing this work allows the Living Well to get in-depth feedback and understanding from those who have received support from them and make consistent changes. It is very valuable we understand how services are for you so that we can attempt to improve them for your future experience. Thank you so much for listening in. I can't wait to see what impact us at Healthwatch Salford will make for the future and patients' experience.